Let's talk about what Invisalign is. Invisalign is a series of clear aligners. So Invisalign is just a brand name. The treatment actually is called clear aligners. Clear aligners are plastic shape aligners that you can wear. And every couple of weeks, every week or every 2 weeks, you change them into a new aligner. Every single aligner gets tighter and goes more toward your optimal teeth position. So when you keep changing the aligners and wearing them, potentially your teeth keep moving into the correct spots. Does Invisalign actually work, or how does it work? Invisalign works with constant small dose of pressure on your teeth, and when it keeps changing to the new aligner, the pressure points keep changing, and potentially your teeth will go exactly where they should be. Now, how long does the treatment take with Invisalign? Remember, moving your teeth is still the same procedure, whether you're doing it with wires and braces or you're doing it with Invisalign. You still need to give it some time, so teeth have to have constant but small pressure. Slowly move to the new position, and the old position has to heal. So everything takes a bit of time. It can take anywhere between 3 months up to 3 years, or sometimes even more. I wouldn't personally do any Invisalign treatment for people if it's gonna take more than 3 years, because they wouldn't have the motivation to keep it in their mouth. In that case, it's actually better to do braces because it's stuck to your teeth and there's really not much you can do about it. But in general, Invisalign cases take about a year. What I see day to day is most cases would take somewhere around 12 months, but it can go up to 18 months, or as I said, even 3 years. When I say there can be a 3-month type of plan, that means that you have small problems, very small problem that can be fixed within 3 months. It doesn't mean that we're going to push your teeth faster or harder, because we can't. It would be dangerous for your health. How often should you wear your aligners? Aligners have to be in your mouth 22 hours per day. We give you an extra 2 hours to have time to eat and drink and relax. But remember, if you're doing braces, they're on 24/7. So you need constant pressure. There are people who sometimes ask me, can I only wear it at night? It's not gonna work. Anybody who tells you can only wear something at night and move your teeth, that's not correct, because you probably sleep only about 8 hours, but you need that constant pressure 22 hours per day so you can see results. Can you eat with your aligners in? No, full stop. You cannot eat with your aligners in. First of all, the food will taste weird because you're just biting on plastic and food altogether. You won't have much of a sensation of the food anyways, but also it will hurt. Not only your teeth, but also food particles will go under your aligners and cause acid attacks to your teeth, potentially causing loss of enamel due to erosion. Is Invisalign more comfortable than braces? Yes, it is. So that's one of the key points for people to choose Invisalign. It's semi-invisible, it's more comfortable, it's much easier to clean. You basically pull it out and clean everything and put it back in, where with braces, that's really difficult to clean your teeth. It is more comfortable because there's no wire or brackets or sharp bits and pieces, so it would feel much easier in your mouth. Is Invisalign noticeable, or is it invisible? Depends on your expectations, because I've had people who had Invisalign done who are models in front of TV all the time. They are news reporters or stand-up comedians. So they can easily talk with them and be in front of camera and not feel that it shows or self-conscious at all. I would say if somebody's sitting at this distance, they cannot see if I'm wearing Invisalign at all. But if somebody looks from here, then yes, you can see a little bit of plastic, the shininess basically. That's as invisible as we can go with moving your teeth. Do you still need to see an orthodontist or your dentist during the treatment? Yes, you do. So you cannot just get your aligners and go home and do it yourself. That way, what was the point of having a dentist or orthodontist helping you? There are many things that can still go wrong during the treatment due to your body's reaction to it. So we want to make sure that we are having everything under control, from your teeth, your gum, your bone. We want to make sure if there's any gum recession, bone recession, any issues happening during the treatment, we either stop the treatment and fix the issue first, or see is our treatment causing that or not. How long do I need to wear my retainers? Now, there are a lot of debates on that, but I would say you need to wear your retainers as long as you want to keep your teeth straight. Basically, teeth always want to move to where they started. That's their equilibrium. That's their comfortable position. So when you straighten your teeth and don't wear your retainers, your teeth move back where they started, or at least move toward where they started. And they might be better than before, but they'll still not be straight anymore. So you need a retainer at least to sleep with every night. There are two types of retainers. You can get a fixed wire retainer, which is a wire fixed glued onto the back of your teeth, usually only 6 teeth together. That will hold the front teeth together and it doesn't let them move anymore, but it makes it hard for you to clean between your teeth because 6 of them are attached to each other. There's also clear retainers, which look like Invisalign aligners, but they're a bit more stiff and they keep your teeth in place. You only wear them when you sleep, but forever. You also need to change them for hygienic reasons and the fact that wear and tear eventually will break them. Can I smoke with my aligners in? It is not recommended to smoke with your aligners because your aligners can get very much discolored. How do I clean my aligners? In the mornings and every time you remove them from your mouth, use a baby toothbrush and a mild soap just to clean inside the aligners. You don't want to have all that stuff that was in your mouth and germs and bacteria just stuck inside the aligner all day. It can cause bad breath and cavities. But you don't want to use any harsh chemicals, any toothpaste, bleach, or boiling water because all of these can distort and scratch the aligner. What happens if you lose your aligner? Let's say you're on your aligner number 10 and you lost number 11. I would recommend call your orthodontist or general dentist, whoever is supervising the treatment for you, and ask them what to do. They might order the aligner for you again so you can use the next number, or they might say you can actually jump a number up. It really depends on how much movement they have planned for their aligner. So if it is a lot of movement, they might not tell you to jump an aligner because that can harm your teeth. What's the difference between Invisalign and braces? Besides the fact that Invisalign is more comfortable, cleaner, and semi-invisible, there are many differences, and when each of them can be used, that I have had another video made. I'm gonna tag it above so you can go watch that. What about at-home aligners? As a dental professional, I would not recommend doing any medical or dental treatment on yourself at home without supervision of a registered health professional. There are many reasons that at-home aligners do not work, but they make things much worse. They can actually cause permanent damages to your bone and your teeth. We have had another video about this that I will tag above too, so you can go and check it out. Thank you so much for watching. I'll catch you next time.